Files presents Healthy Living. Local health experts answer your questions and keep you up to date on the latest in health trends and technology. Bringing the health advice you need to prime time, it's Healthy Living, live on the Fox Files.
Hello everyone and welcome to the Fox Files. Tonight's topic is heart defibrillators and issues regarding the heart. The phone number to call is 741-5510. We'll get to your phone calls in just a minute, but first let's welcome tonight's guest. Tonight we are joined by Dr. Felix Sogade, who is with Georgia Arrhythmia Consultants. Welcome to the program.
Thank you.
It's good to have you here.
Yes.
Now, I'm sure a lot of people have been watching the news lately, and there was an article in the Macon Telegraph that was picked up from a Chicago newspaper that was referencing an article in the Journal of the American Medical Association that quoted that 1 in 5 heart defibrillator implants were questionable. Do you believe that to be true, or what do we need to know about that?
What we need to know is that defibrillators are implanted mainly to prevent people from dying suddenly. We have to recognize the fact that sudden cardiac arrest is the main reason why people die in the United States. Almost 500,000 people die each year from this condition. When you put the mechanisms of dying, including breast cancer, AIDS secondary to HIV infection, and strokes, when you combine all these causes of death together, still more people die from sudden cardiac arrest. So we don't want to lose sight of the fact that the only treatment that prevents somebody from dying suddenly from sudden cardiac arrest is a defibrillator. A defibrillator is a small device very similar to a pacemaker, implanted with a very minor surgical procedure that will help prevent someone from dying suddenly. When we look at, there is also a lot of confusion between sudden cardiac arrest and a heart attack. Actually, almost 70% of people in the United States believe sudden cardiac arrest and heart attack are the same. The main distinction is that with a heart attack, there is compromise of blood flow secondary to blockage in the blood vessel to a small portion of the heart. Sometimes a heart attack may lead to sudden cardiac arrest. But in sudden cardiac arrest, the heart has completely stopped and the person is unresponsive, and if immediate therapy is not given, that person is dead. Actually, the chance of dying is 10% for each minute. So that if somebody is in cardiac arrest for 10 minutes, the chance of survival is almost zero.
Now, what is the difference between a heart attack and cardiac arrest? What do we need to know?
What the public needs to know is that with a heart attack, the patient will present usually with symptoms of chest pain, and they're usually still talking to you. And a heart attack is due to blockage in the blood flow to the heart. It's like a clogging in the blood vessels that supply blood flow to the heart. In a cardiac arrest, the heart has completely stopped, and the heart is the main engine that drives the whole body. When the heart is in cardiac arrest, there is no blood flow to the brain, no blood flow to the vital organs, and in essence, that person is dead. And when you look at with a cardiac arrest, unless a bystander initiates CPR or a defibrillator is available to shock the heart back into rhythm, that person will most likely not make it.
What are the early signs that for people who may experience cardiac arrest or a heart attack, are there any clues that this may be about to happen? What does it feel like to happen to you?
Unfortunately, it is almost impossible to really know, because for some people, the first symptom of a heart disease is cardiac arrest.
Okay, we're going to go ahead and take a quick break. After the break, we're going to go ahead and do a demonstration that you've got for us on CPR. So don't go away. The Fox Files will be right back. All right, and welcome back to the Fox Files. And tonight we're joined by Dr. Felix Sogade, who has provided cardiac electrophysiology services and research development to our area for the past 14 years. He's a fellow of the American College of Cardiology and the only fellow of the Heart Rhythm Society in the Middle Georgia community. And now you're going to explain to us what the community can do to improve our chances of survival and the chance of cardiac arrest.
Actually, when somebody is in cardiac arrest, the most important symptom to recognize is that the person is unresponsive. And when somebody is found to be unresponsive, the next step is to call the emergency medical response system. In essence, 911 should be dialed, And once 911 is dialed, do not just stand around waiting. It is important to initiate CPR. Actually, the criteria and the way we do CPR recently changed by the recommendation of the American Heart Association, that we do not need to do mouth-to-mouth resuscitation anymore. The only thing that needs to be done is to lay the person on the back as demonstrated by the mannequin, and then you initiate compression. And you initiate compression by pressing as hard and as fast as you can, as demonstrated by Cartier. And this is all that needs to be done when somebody is in cardiac arrest till ambulance services arrives. And once ambulance services arrive, then a defibrillator should be applied. If the person is in an abnormal rhythm that can be shocked, the shock should be delivered. The other thing that the community can do is that they are what we call AEDs, or automated external defibrillators. We see this around the airports and in a lot of our schools and public places in Macon. Once somebody is in cardiac arrest, actually anyone can use this, and the paddles should be applied to the patient's chest. There is a diagram showing you what to do, and if a shock is recommended, then you just press the button and deliver the shock. So it is very important that the community is aware of these efforts. And actually, in our practice, we are using the opportunity of the Martin Luther King Day as a community service day to train the general public in how to conduct basic life support till emergency services arrive.
Now, where can you learn how to do this life support type system, the CPR that she's doing right here? Where can you learn how to do that? Basically,
there are a lot of free courses offered by the fire department, American Heart Association, and other volunteer services in Macon. And as I mentioned, our practice is also going to use the opportunity of the MLK Day to provide training for people in the community.
Now, you mentioned the AEDs. Now, is this something that every neighborhood or community should look into getting and investing in?
The most important thing is that every place where there is a aggregation of people, whether it's in the stadium or in the schools or in any place where people tend to gather, should have an AED placed. And an AED is very easy to use. That the way it's designed is that any sixth grader who has never been trained on using an AED can really just from scratch land right on the scene to use it.
Okay, now with the AEDs, how will you know what to look for? How do you know that's what the problem is?
With an AED, what you do is you apply the patches onto the patient's chest as shown in the diagram with the equipment, and the AED will actually tell you, will give you voice instructions on what to do, and you just follow the steps as recommended by the AED.
Now, when you take the classes for the CPR, do they also teach you how to recognize the symptoms of a heart attack as well?
They teach you the symptoms of a heart attack. Like I said, most of the symptoms is that for a heart attack is often the chest pain, but for a cardiac arrest, on the other hand, the patient is not responsive, and they are usually not breathing, or their breathing may be agonal. And once the person is not responsive, the next step is to call 911 and immediately, and you initiate compression on the chest while you're waiting for help to arrive. And if you have an AED, you should apply it.
All right, then, thank you so much. And welcome back to the Fox Files, where we are joined tonight by Dr. Felix Sogade, who is a fellow of the American College of Cardiology and the only fellow of the Heart Rhythm Society in the Middle Georgia area. Why don't you tell us what that means to be a fellow of the Heart Rhythm Society?
A fellow of the Heart Rhythm Society is actually a special designation that describes somebody who has contributed significantly in the treatment and clinical research in the management of cardiac rhythm disturbances. It is actually a special recognition offered by the society.
And what is a cardiac electrophysiologist?
A cardiac electrophysiologist is a cardiologist that has received extra training in managing and recognizing treatment disorders, rhythm disorders that may affect the heart. And basically, these doctors actually perform tests to find out why somebody may have an abnormal heart rhythm. Oftentimes, these abnormal heart rhythms may result in cardiac arrest.
Okay, and at the beginning of the show when we were talking about the article that appeared in the Macon Telegraph, that was from the Journal of the American Medical Association about the heart defibrillator implants, why don't you explain to that how it may be possible for it to be inappropriately placed and why that could happen?
It is important to recognize that sudden cardiac arrest is a condition that does not lend itself for you to be wrong. If you are wrong, the person is dead. And I think what this study has shown us is that it's a study that looked back at what was done in the past. And we have guidelines that, for example, if somebody has had a heart attack and their heart muscle function is reduced, we normally should wait 90 days before we implant a defibrillator, or if they have had a procedure whereby the blood flow to the heart is open, we should wait 90 days. But sometimes some of these patients are not doing well before the 90 days. And oftentimes what will happen is that a physician may decide that this particular person may be unstable or unsafe, and that procedure may be done earlier. Unfortunately, that kind of guideline may indicate that this procedure may be inappropriately done. But in essence, physicians make decisions really based on an individual basis, not based on overall data. So sometimes it's important to recognize that these treatments may be offered earlier than the guidelines recommended. And that does not necessarily mean it's wrong, but it's just that for each person, the time to intervene is different. Sometimes some people actually die while waiting for that period of time, and as a doctor, your responsibility forces to the patient.
And for the patient, what do we need to know about the procedure for those implanted defibrillators?
The procedure for the implanted defibrillators is actually done in a procedure room, usually in the hospital. We usually administer sedatives like Valium or morphine to the patient, and with a local anesthetic procedure to the skin. The device is implanted just under the skin, and the wires are positioned into the heart, and it takes about 30 minutes to 1 hour to perform, and the risk of the procedure is quite low for most people, usually less than 1% risk.
Okay. Now, for patients that may have been referred to a cardiac electrophysiologist, what type of questions should they bring with them?
And the main important question is, I know with this article that was published 2 days ago, the main important question is for the patient to ask what is the risk of the procedure, what is the experience and the training of the physician that is going to perform the procedure, and how long it will take them to recover.
Okay, that's a very good questions to ask. Thank you so much for joining us, and thank you so much, Dr. Sogade, for joining us today to answer all of our questions. And if you'd like to contact a guest from tonight's show, you can reach Dr. Sogade at Georgia Arrhythmia Consultants at 755-1550. Thank you again for joining us, and please be sure to tune in next time for another edition of the Fox Files. For our guest tonight, I'm Portia Lay. Thank you for watching News Central at 10.